All right. Hello, everybody, and welcome to the Off-White Coat Podcast. I'm your host, Jordan Abney, and today I'm joined by a very special guest. She's the author of The View from the Clinic. It is One Nurse's Journey in Abortion Care. She has been working for 38 years as a practicing nurse in both clinical and academic aspects of this field. And she's spent many years in an abortion clinic, and she's here to speak with us today. Everybody, please please help me welcome Patrice D'Amato.
Perfect.
Did I get it right that time?
You did. That was perfect. Thank you. It's so great to be here.
Yes. So I'm just glad that you actually wanted to speak with us and everything. I read a little bit of an excerpt of your book, and we have something in common.
Yeah.
We're both Hispanophiles.
Oh,
I
good.
love the Spanish culture as well.
Oh.
It feels like every time I go anywhere, it's either to South America or Latin America.
Yep.
So starting to pick up Spanish just a little bit. Still pretty bad, but
I'm not great either. I'm okay, but yeah.
it's the getting around, and I guess that's one point that I did want to bring up because I read it as the excerpt in your book was you had the lady that there was just the language barrier set up, and then whenever she was drinking the mate or whatever, and the pill the lady was taking, I think, correct me if I'm wrong, but it was the birth control pill.
Yep.
And it was actually falling under the leaves or whatever of the drink, and that was something that I actually experienced once before. Was this lady was drinking this chocolate drink that was given to her from her friend, and she said it was to get rid of headaches, but her blood sugar shot up into like the 400s. And so she was like diabetic and everything, and she just told me the name, and luckily I went and looked it up, and then I showed a resident, and the resident was like, oh, that's a cultural thing, that's got like condensed milk and chocolate and everything. And I was like, oh, this is what's causing her blood sugar to shoot up.
Yeah, right.
So
Right.
I mean, you really do have to pay attention to the cultural stuff.
Yeah.
And that's, that was just a unique thing that I saw. I read in the book. I was like, oh, we've had a similar situation with that one.
You'll see more. You'll see a lot more. Happens all the time. Yeah.
But yeah, so I really just wanted to, besides getting on that whole aside, I wanted to ask you about like your time. So how many years have you been a nurse? And are you still a nurse right now?
I am working, like I would say, I call myself semi-retired. So I've been a nurse now for 39 years. Yeah, a really long time. So I always tell people nursing school can be very short. So I was 20 when I became a registered nurse. So I used to joke, it wasn't actually a joke, it was funny. I couldn't go out after work. I would give IV morphine all day long, and then I couldn't go out for a drink after work. I was underage.
Oh, yes.
Was underage.
Mm-hmm.
So that's why I just say I'm not that old. I just started really young. But yeah, so the trajectory into nursing can be pretty short, unlike medical school, which takes so long.
Mm-hmm.
So
yeah, I'm like at the edge of 30, and
I know it's just crazy to me, and it's just frustrating. But I did keep going back to school. So I worked as an RN. I went back for my bachelor's degree. I went back for my master's degree, all while working. I was ending up taking I had to keep taking organic chem again because the other one didn't, transfer to the next university and all. So I was like working as an RN on a med surg unit in the evenings, 3 to 11 shift. And I was going back to school, taking chem, bio, all that stuff in the mornings. So it's like backwards a little bit from medical school, or it can be. Yeah. So it's kind of wild.
Did you always know you wanted to go into nursing?
I did.
Okay.
So I actually have a chapter in the book all about my mom, Doris, the nurse. And so my mom was a nurse, and she actually was the person who well, I didn't go into abortion care till later, but she certainly got my back up about it because she worked as a nurse in the 50s. I mean, she was a student nurse, and then she had to, once you get married, you weren't allowed to be a nurse anymore. Like you had to leave. You had to go be a housewife.
Mm,
Yeah. And she was really bummed out because she really loved working, but she had kids, and that was what you did in the 60s. But she did tell us stories, and I don't want to give it all away because it's in the book, but she did tell us stories about the time before abortion was legal and what that looked like in the hospital. She went from a rural town where she grew up, and she went to work in the big city, and saw patients. And there's one I described pretty poignantly that she described to me, who, was raped. It was a woman, a married woman who had been raped and was forced to carry the pregnancy. And my mom was there. And,
mm,
not to get into it a lot, but it was a question of, the paternity question was pretty clear once the baby was born, that this was the result of the rape, not from her husband. And there was so much drama. The husband left her. The baby was, I don't know, they don't know, given up for
mm-hmm.
adoption or whatever. So anyway, my mom's stories were like really powerful for me, and did help shape some of my interests. I didn't go into OBGYN. I didn't go into women's health, actually, and it's not my favorite thing, to be honest with you. And again, I outline that in detail in the book, so I don't want to go into all of that. But I
Mm-hmm.
did spend most of my time with,
Yeah, everybody
you
check
know,
out the book.
yeah, yeah, yeah. Thank you. Just a plug, but I already say it. So there's no, and it's an easy book. It's an easy kind of fun. Like if you can believe it, it's a lot of it's really funny, especially to medical
Yeah,
professionals,
the way
because
you were like describing everybody, I was like, oh, okay, like
yeah,
this is more fun than like medical textbooks. It's like boom, 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 boom.
yeah.
Um,
Somebody said to me, they were like, this is like a girlfriend's guide to abortion. I was like, yes. And that's what I want. I don't want to be like lecturing people. There is a whole chapter about the history of abortion. I'll talk about, medical care and all that kind of stuff. But I really just want this to be, like an informative but entertaining thing. So anyway, I did go into nursing. My mom, kind of opened the door. I was really sick of hospitals, like sick of hospitals. I had worked in hospitals for like 14 years. And I
mhm,
was like, I got my master's. I became a nurse practitioner. So I left and went to the abortion clinics, worked there for like 8 years. And then was like, I talk about that too. Um, so anyway, then I went into teaching. I taught at the university for a while, and only recently I started working for the abortion clinics again. I always call that my women's health home because it really hasn't been the major focus of my career, but I do love that. I do love that care. So right now I'm working part-time for them. I'm actually doing telehealth, telemedicine. So I handle the calls from patients who are experiencing complications or have questions post-abortion, both
mhm.
medical and what we call surgical or in-office abortions. That you don't really want to call it surgical necessarily, but we still kind of just call it that.
Yeah. How many patients do you usually see a day?
Well, right now I'm only working remotely and I'm on call. So
Okay.
like I'll just be on call like 24 hours, and I it depends. I cover 5 clinics in different states. So Georgia has become very quiet because of the laws.
Yes, yeah,
So,
I was about
it
to say
used
I
to
could
be
only
my
imagine.
hop-in. It was my hop-in state. And, I would get calls from all, neighboring states. And it was always really a challenge because, well, the challenge is like, I had one woman, I was like, yeah, you should come back and be seen. And it was some like she had a retained sponge or something. And I was like, okay, well, we'll get you in and we'll just, and she said, no, I have a mirror. Tell me what to do. I just drove 12 hours from Texas.
Oh my goodness.
Yep. So I was like, can I curse?
Yeah, you can. Hey, no, it's you can certainly curse though. It's fair game.
God, I was like, shit.
Yeah.
So, and,
Oh
a
my
couple
goodness.
other, right. Like it was just like a thing that, so anyway, it's been nuts. And then I have patients like who are coming over from other states. Like I've had, from, and mostly in the South, I will say, like Mississippi, Alabama. And they're like, I'm not going to my hospital. Are you kidding me? Because I'm like, you got to go to the are,
Yeah.
so I do manage people, and I try to manage as much as I can on the phone. But right now I'm working in the capacity of being an RN. I put my nurse practitioner license on inactive because I don't really like being a nurse practitioner. It's like I could have gone to med school. That's
Hmm.
really, it's the job of a mid-level provider without, and I really love the aspects of being an RN. So I'm older now, and I'm pretty confident in who I am and what I do, and I don't need to work in that capacity. So right now, I'm really really loving just working as a nurse and talking
Yeah.
people through stuff. Yeah.
You can tell by like the passion in your voice, and like you just seem really excited when you're like, ah, so that's awesome. It seems like you're in the right spot.
Yeah.
When I was about to ask, so you have because that was something that I learned recently too. Like I've had been looking up stuff, is that sometimes when people travel, there was like, and I think it was in like the state of Missouri or whatever, that they were talking about, you had 72 hours. And I didn't really understand, there was like a gap where you had to
Oh
wait
yeah.
72 hours. So
Yeah.
they would drive 12 hours, then
Yes.
wait 72.
Yeah.
And then
Yeah.
so it just which I guess that was just to give them a chance to
Change their mind.
reconsider.
Yes. It's
Yes.
like a waiting period, and okay. Okay.
I
I'm
guess
not
I
like
get
a
it, but this
yeah.
one lady, it was due for her own safety. I think she had adenomyosis or some
Okay.
other kind of uterine atony, so there was no way it was going to
Oh.
happen. But then she had to like drive. So then she had a whole emotional incident. It was it was a pretty interesting documentary. Is Abortion Stories Women Tell, and it's
Okay.
on HBO or whatever. But
Oh.
it gave me at least a little bit more insight, and at least to some of the things that, because I don't necessarily keep up with all of the laws. You could probably tell me more.
Oh, I can't either. I mean, they're so nebulous. That's the problem.
Yeah,
But yeah, and then the uterine atony. I mean, like she was at risk, but okay, so she was at risk having the procedure. She's also at risk carrying the pregnancy. Like, it's just a shitty situation.
yeah. So was that common too? Did you see that? I'm curious to know like how many of the people, and this is without breaking like HIPAA or whatever, but
Oh yeah.
like how many people came in and actually had like one of the hard no's for pregnancy? Or I guess you could go first on like what would be like a hard no, like you wouldn't want
Oh,
that
hard
person
no. Okay.
to
I think you
continue.
said hard
Yeah.
nose. I'm like, what? A hard
Oh yeah.
no.
Contraindication. No.
Contraindications. Thank you. Thank you. Okay. So very few. I mean, well, and the other thing is they get pre-screened. So, it's a surgery center. It's ambulatory care. Basically, it's an ambulatory surgery center. So anybody who, might have like factor X like Christmas tree disease or
Hmm.
like contraindications to anesthesia, or like weird things like that, they would be referred to the hospital. So that
Oh, okay,
stuff,
okay.
it gets done. It's just considered a high risk case. So and there's not a lot of them because these are young, women of childbearing age. So you don't see a lot of really weird things generally in that population, which was part of
Hmm.
what drew me to it too, after working in hospitals and seeing the sick in university hospitals, like where people are transferred in from outside hospitals, and you just see like the crazy sick weird stuff that you see. So when in a freestanding clinic, you're just seeing young healthy people. So there's very
Okay.
few, yeah, very
I didn't
few
know if there were like
contraindications.
how many were elective and then how many were like
Great
they saw
question.
as net.
Yeah,
Yeah.
yeah. So we did get some that were not like, so we would, I would say like 98% were elective, but then we did see patients with fetal demise.
Hmm.
And I did write about that too, because like that's really hard when you have somebody who has a fetal demise, especially, oh, I'm giving all my chapters away. But somebody who may have gone through a lot of infertility treatment, and I saw it, and then they show up and they're like 14 weeks and it was fetal demise, and they're sitting next to all these people who are having an elective abortion. Like, it sucks. It's a really hard situation. But how many? It was rare. Like, well, not, I mean, not rare, because like it's weird, but abortion clinic, like abortion cert, like the procedure and stuff, it's a specialty. And so, to get really good, effective care, you would send these people to like a women's center, an abortion clinic, because we know what we're doing.
Hmm.
And so it was that's always a challenge when you have somebody who's there and they're not super happy about it. Like always I would say, anybody who's wearing maternity clothes when they come in, they're not happy to be there. Like they wanted this baby.
Yeah. Ugh. Yeah, that's tough.
Yep.
Yeah, because I mean, for one, if there's like fetal demise or something, that's already tragic as it is.
Right.
And then to have to go somewhere else and do
Right.
all this, it can be, I can imagine that the job was emotional
Oh,
on a day-to-day
yeah.
basis.
And now what's happening, this is even sicker and worse, is that like somebody like that, if they're in the hospital and they had fetal demise, like the laws are so unclear that there's a lot of places where the OBGYNs are and the nurses, like the staff are standing around waiting for this woman to get septic because they're not allowed to, they're not allowed, they're not permitted to terminate the pregnancy until the mother's life is at risk. And I am not kidding you. I am
Oh my
not
goodness. So yeah, that's what I
friggin'
was about to say.
kidding. So they're standing there like, how septic is she? How long do we wait? And when somebody's septic, you don't have there's no cookie cutter answer to that. And they could end up just dying because, like, it's sepsis, right?
Yeah.
It's just I don't know. I don't know how people do it. I don't know how
Yeah,
they
it's not
do
really
it.
best to wait till they're septic to treat the sepsis.
Right. So they're like trying to figure out, am I gonna be hauled off to jail for doing this? Like, how do we
Yeah.
document that? Like
And it
it's
can be
it's
tricky, especially when there's laws in place that aren't associated with a hospital. Like, as in the
right.
hospital, if the hospital was to govern themselves, they would say, oh,
Oh,
okay, we need to just do this. But
right. Right.
outside
Or there would be a
sources,
board or protocols or something, but there are no
yeah.
protocols because these don't even make sense. These like wait till the mother's life is at risk, even though there's ancephaly, the baby doesn't even have like brain matter. That's sick
Mhm.
and cruel. And that's what's
Yeah.
happening.
So if the state says it's completely illegal and something like that happens, is it, I guess that's when they have to just wait until
Yeah.
the mother's life is in jeopardy? Is
Yeah.
that common? Like, do you know how many states that is?
Well, I think there's 15 states with restrictions. The
Yeah.
restrictions vary, and I am no expert on this stuff. Like I'm a clinician just like you. So I can't even like I have enough to
It's
do
tough,
taking
yeah.
care of
And
patients.
you see the people too, which is one of the hardest part is when you see like the actual person and their individual issue and it trumps all the other politics and
Oh
everything.
my
You're
God.
like,
Yeah, but it all sits on it, right? So like I was like going when I was going back to return to work for the clinics and I'm talking to, the interviewer and she's like, "Oh, I got to go. The protesters just cut our water lines and we're in the middle of surgery day." So they have all these patients, like 30 patients in there. They're in the middle of doing cases, and the protesters managed to cut their hot and cold water lines. So they had no water. Like, so that's on top of all of the everyday stuff. So it's just, it's just wild right now.
yeah, the one thing that I did get like the most important thing I got from that documentary was like it seemed like the biggest problem out of all of it because I'm neither choosing a stance, a political side, or whatever, but
Right.
the worst like the people that were doing the most harm were the protesters outside that
Oh my
were like
God.
harassing
Yeah.
the ladies for one. Obviously, even if like I don't if you protested on like Capitol Hill or anywhere else, but to stand outside the actual place and
Oh
like
yeah.
because they badgered the not only the people going in, but all the workers going in, all
Oh
the
yeah.
workers coming out. And
Yep.
so I was curious to I guess you've had plenty of
Oh yeah.
experience with yeah.
Oh yeah, but I hate to keep plugging this, but you will my one of my other favorite chapters is about our friend the protester, Joe the protester. So yes, you get badgered in, you get badgered out, you get spit on, and it's hard enough. The job is hard enough.
Yeah. I mean, you're
You
just
know,
trying to do a nine to
oh man. I went by the other day, I had to drop some stuff off and the protesters are out there and I'm just going to say this because I'm just going to say it. The white ladies from the Catholic Church were all out there with their, don't abort your baby. We'll help you. And then outside the clinic, it was a busy day. And, all my African American patients are out there like on their cell phones looking at them like, lady, get a clue, get a clue.
Yeah.
So I just walk by it all. I'm just like, here I am. I mean,
Yeah, and so you have to almost compartmentalize and just walk in blinded to the fact that all the chaos around you is going on.
Yes. And like it's just, and everybody is there. Like this clinic is in a suburban setting near my home. So like I know people that going in and out on both sides, like just, and they see me and I'm like, hey,
Yeah.
hey protester, or hey
Yeah, you start.
kid,
I was about to say
hey
because yeah,
friend of
you do
the
start to
kid.
get to know the community one way or another if you work in a hospital or a clinic.
Oh yeah, if it's big enough, you don't like. I after a while I just started working over in the city exclusively because I was like, I can't. I'm a soccer mom here. I know too many of these people and I'm just out of here because it was. But in a small town, if you're delivering care, absolutely you see people, and
Yeah,
both sides. And these are not people who want to see you. Let me tell you, when you walk in with your white coat on to do their exam, their post, I used to do follow-ups and I walk in with my stethoscope, my white coat, and they're like, oh my God. I'm like, listen. I had my canned spiel about that. Like, yes, it's me. Yes, we know each other. And I will tell you that when I see you next week at PTA, I'm not saying anything. And if you don't want to talk to me or small talk, I totally get it.
hmm
Yeah.
yeah. That I mean, because neither the patient or the protester or anybody really wants to see you in a white coat.
It really does. Not there.
Not there. No, that's what I meant. Not
Right.
everywhere else. Yeah, that's fine. That
I mean,
one.
well, it depends. There's other things that are sensitive, but like you don't talk about that stuff. And my goal, honestly, is
No.
to change that in life so that we can say, like you can say, oh, how was your knee replacement? Oh, you're doing good. How was your abortion? Are you doing okay? Yeah, good.
Yeah.
Like that's my goal and I do think young people are getting a little bit more, like, listen, don't be judging. No, no haters. So I love
Yeah.
that.
I think the problem is the judging because we all tend to choose like a soapbox that we stand on.
Right.
We'll be like, oh, high and mighty over here, but then we let it slip over here. Maybe we're a glutton, but yet we believe in something else. And
Yeah.
so I feel like when we're judging other people, especially if we don't live in their situation, that's sometimes the
Well,
worst.
yeah.
It breeds itself to hypocrisy really on the other end.
It is really endemic in healthcare, in the healthcare profession too. And I will just say, I'm glad you said that because I wanted to talk about frequent flyers.
Hmm.
Because the nurses, when I was on their podcast, they were like, "Do you have frequent flyers like we have, in regular hospitals?" I'm like, "Of course we have, of course." And I don't think that people in abortion care really want to talk about that, but we see it in the medical community. So, just like you have people who are, in CHF and like, why are they back? We tuned them up. We did their,
Yeah.
we did their LASIX. We educated them. We did everything. And like 2 weeks later, there they are with like an 8-pound weight gain. And like, you're like, why? And I think that we as healthcare providers get super judgmental and super frustrated. I don't think we mean to necessarily be judgmental. Some people, it's the healthcare profession. Some of us do, and especially students are still like, I'm not going to be like that. And
Yes. Yeah. Every student says that, and then for some reason, 50% of people end up like it.
like what I know. It always I guess it makes me laugh, but it makes me frustrated too
No,
because
it
I'm
does
like,
make me laugh because it's so funny. There's so
it
many
is.
idealistic people. I'm like, I feel like you're the first to turn.
You'll be the first one. I know. It's like, don't do, I'm never going to be like that preceptor that I had. They were so mean. Like, why are they so mean and hateful? Well, you do get frustrated, but like you have to dig deeper, like you said. So that's why I
Mhm.
love that chapter about the lady. Okay. So she was, 48-year-old Latino female, gravid of 15, para 4. And last week, let me just add to you that I had a 29-year-old, I'm looking her up, 15 pregnancies, 2 children. And I see
Mhm.
it a lot. Okay. I see it, I mean, a lot. because 75% of my patients are, you know, are either socioeconomically disadvantaged or they're, brown or black. And this is a population of people who are definitely being impacted the most by these crazy laws. Like, so, and so you have to ask yourself, like, you, there's so many people who say, well, I believe in abortion, but like, I believe in it, but it shouldn't be used for birth control. Okay. All right. Well, let's think about that. Let's think about, why is somebody using abortion that way? It's just like the CHF patient. It is. It's just like that. Like, and we also don't do a great job of saying, well, why? What's the problem? What is
Mm-hmm.
the problem with 7, 8, or 9 abortions before you're, 27? Let's talk about that. Because there are some issues with that, but like, why is that a problem? Is it because like the egg is already fertilized? Like, where are we with all of that? And I can tell you that my patients don't always see it as a problem. So
Mm-hmm.
why do we?
Yeah. I mean, I guess in the only, because I assume that there would be more complications or more damage to the body the longer if you kept going through this process,
Right.
and especially if you let it go 12 weeks, abort, 12 weeks, abort, 12
Uh-huh.
weeks, abort,
Mhm.
especially with the surgery. I could see that, and I could
It-
see maybe where it would be more um like expensive, but I definitely, the judging is the problem that I can't, because you're just, it to me, if they don't care, right, then I mean, you have to also, like, if they're paying for the service or whatever, it's kind of like, what are we
yeah.
doing? You know,
I
why
mean,
are we
how do you
judging
judge?
the,
Right.
yeah, how do you judge somebody else is the biggest thing I have a problem with.
Look at everybody's charts. I get to look at all their medical and contraceptive history. And I will say to you that these people they are trying to use birth control. Okay. Like 90% more, probably 95% of these charts. When I look at somebody who is, 15th pregnancy, eighth termination, I go back through their chart. They have tried everything. So even then, they've gotten the message. Like,
Yeah.
they've been on the pill, they've been on the patch, they've done the shot, they've had the implant. They run out of money. They run out of, they don't have the ability to like get to a consistent provider. Like, there's a million reasons for it. So we have done a good job, I think, of teaching people why it probably isn't great to rely on abortion for birth control, but there's so many socioeconomic and psychosocial issues around why they do it. So,
Yeah.
right?
That's what I was going to ask, is it a lot of people just using it as birth control, or it's more of like lack of education or understanding of not just education in a general sense, but like medical education and understanding how all that works. So now you
Right.
keep getting pregnant and you're not even, you think
Right.
you're not trying, but yet you still keep getting pregnant, because that
Yeah.
is definitely
Yeah.
um a problem.
Absolutely.
Yeah.
That's a huge problem. But part of the problem, yeah, I think people in this country do know how you get pregnant. And most, like I said, 95% of the women have tried something to prevent these, pregnancies. It is complicated though, because what often happens too is their partners. So you're also laying on top of this, some partners. I can't tell you how many times a woman has put me on the phone and said, please talk to my boyfriend, please talk to my husband and tell him that why I can't keep doing this. So,
Mhm.
or why I really can't have sex right now. And so I would talk, I counsel a lot of women because they're like, when can I have sex again? I'm like, well, when you feel ready. And not more often, no, not more often than not, but sometimes they'll be like, could you please tell my boyfriend that I'm not allowed to have sex for the next 6 weeks because he won't get off of me?
Yeah. Yeah.
And I'm like, well, I
I'm
mean,
gonna
I'm
need
not
a
going to
doctor's
lie, but
note for that one.
I need a doctor's note. Right. Exactly. Yeah. So you have all that going on as well.
Mm-hmm. Yeah, and I can imagine also that there's some people like, so I remember when I was in my OBGYN rotation, is there, like, there's some people that while they could go through with the pregnancy, like it might be very unlikely to even go to full term or whatever. So I remember seeing this lady and she was like 350 pounds, giving birth to twins.
Yeah.
And it was still early in the development stage. And I remember the doctor, while it was a Catholic hospital, so he couldn't actually say, they couldn't do any abortion, but he was like, honey, you really don't need to do this. And he was a very old, older man, but he's very blunt. And he was just like, you need to go not at this place because it won't allow us to tell you about it. But he was like, you don't need to go through all of this just because I don't see it actually going to term. Now, maybe it did or whatever. But you had written about somebody else that was like 48 years old. And I think they had like 7 kids already. And they had gotten pregnant again. And it's like some of those people, the older you get too, you increase your risk of complications and non-homologous recombination. So is there ever an age where they where you're kind of like, maybe we shouldn't go through everything or go through with it?
Go through with having an abortion or pregnancy?
Pregnancy.
Yeah, my oldest patient was going to be 50 when she delivered, like if she had carried to term.
Yeah.
So,
and I guess that's possible, but it's also real risk. Yeah. Like it feels like when you're playing with the odds and you've rolled the dice.
There's those women that are like getting implanted, like, in Italy, and they're like 60 because they're doing, they're a surrogate for somebody and all that kind of stuff. But it wouldn't be age so much as it might be other complications, like other comorbidities that might, that you would consider in terms of counseling somebody whether to carry or whether not to carry. A lot of the counseling too, people have this perception that at abortion clinics, nobody asks. They're like, yeah, you want an abortion? Fine, sign here. It doesn't really happen like that. Like they do have to go through, options counseling and then right across the street, there's always this option, those fake clinics. Have you seen those? So I used to have patients show up and they're like, why did they tell me down the street that I'm killing my baby? Like, so these centers are set up. Oh, they're there. Trust me, they're there. They're usually like a couple blocks away. Yeah. They're called options pregnancy counseling. You'll see them. They're everywhere. Pregnancy counseling centers, like Options is a big one. They actually even make them look like an abortion clinic, but they're actually operated by pro-life groups and they look just like a medical clinic, but they're usually staffed by volunteers. They might have a medical person at them who is very pro-life, but they give them information about like this, all the medical bad things that will happen to you if you have an abortion, and then they, the patients walk away scared. Those places are pretty popular. So just so that
oh my goodness, you would think that
they're going to tell you they went to a place like that, and they're going to say, yeah, but the doctor told me I'm going to get breast cancer because I had an abortion, which is there's an old study, and actually it's was on a billboard near me. You get abortion causes breast cancer. Have you seen that one?
I haven't seen the billboard or anything. I haven't. I don't remember learning about that either. But
well, it's because it really isn't a thing.
Yeah, I was about to say. I was like, that one I find hard. Okay,
going to a real accredited medical school. But it is so
thank God I didn't learn about that. That would have been a tough one.
No, yeah, there was a study back in like the 60s or 70s, and they did link, there was a correlation, but it wasn't causation, and it's so they keep touting this thing, you're going to get breast cancer. So you will hear stuff like, well, from patients, well, I read on the internet that, I'm never going to have children, be able to have children if I do this, and you're like, what do you say? Like, stop reading the internet, right?
Yeah. I mean, everything on the internet is true. No,
right. Oh, and now there's TikTok. So I just saw that one at this girl, like, guess what? You can't get pregnant if you're not in love. I'm like, oh my God.
Yeah. And the crazy thing is, like, TikTok too because I've got, I'm the oldest of like 7. So all of my sisters are much, much younger. And so they get like, you can get so much information from TikTok from like them, but then also half of it could be just false and people just playing around.
Oh yeah, you have no way of knowing. So really, you have no way of knowing. If you're not a medical person, it's really it's scary. So of course there's tons of misinformation out there, more than ever, more than when I started practice, and you're right, you're stepping
Hmm.
right into it, you know.
And you can't even Google. Like I found it even difficult. I'm thinking about something that I've already learned, and so I'm like, oh, what is that molecular mechanism of action of something? And I type it into Google, and Google's like, you may have testicular cancer, and I'm like,
Oh my
what?
God. That's not really what
Uh,
I was looking for.
and you're like, okay, and then you're like, oh, I completely see how people get mixed up,
Yeah,
and it's just super confusing. I'm like
it
just
is.
looking for one thing, and it's like you may have factor five, and
I
you're
know, I know. I mean, you thought
like,
that
go
anyway.
see your doctor. Yeah, I know. You're like,
Well, in medical school, you know, or nursing school, oh my God, maybe I have that. But like, if you're a layperson and you're relying on this information, and then it's really hard as the provider, right? Like people are telling you this and they're convinced, and you're like, you know, it's really not a thing what you're saying. I don't know how to
yeah.
help you here.
Uh, so for one question I did want to ask you is, were there any difficulties in writing your book? Like
Uh,
switching from the clinical side, you've been a clinician essentially since you were 20, and
right.
then you decided to write a book. Well, like, was it difficult to do the switch, and what were your intentions when you started writing the book?
Okay. So yeah. So it was, I mean, this is a big change for me. I wasn't an author by background. I always liked writing, you know, I enjoyed writing, but I didn't ever plan on writing a book. I was just gonna, you know, work and teach and whatever until I retired. So what happened a couple of years ago was the Me Too movement. Remember Me Too?
Yeah.
And so I'm listening, and I walked away from abortion care specifically, like in the early 2000s, because I was like, this is people are nuts. No one can talk rationally. We can't talk rationally. Like you can't have a
Yeah.
rational discussion. So I was like, all right, there's other things I can do. This is one specialty and I am done. I just can't. So I walked away from it. But then like 15 years into teaching and doing some other things, and then this Me Too thing came up, and I listened one day. I'm listening to this politician talking about how they want to tax women's sanitary products because um, so you should pay tax on your tampons and all that stuff. And there was this big debate about it. It was like right during like Me Too. And this politician's like, well, they could I don't understand why this should be tax free. I mean, you just hold the blood and then when you go to the bathroom, like if you pee it out. And I was like, okay, I'm done. Like I
Yeah.
I'm done.
I'm
We
sure it was a male.
it was a male, a
Of
married
course.
man. And I'm
Yeah.
like, okay, you're a married man with like children. How do you not know the basics here? And how are you making decisions about this? So I was like, all right, I'm writing. That's it. I have to talk about this. Nurses have to write.
Hmm.
Physicians are I think better at writing. Like I love Atul Gawande, bless his heart. Like he's amazing, and you don't hear much from nurses in that aspect of it, like you said, that really human, like down and dirty,
Yeah.
like we're in it up to our elbows every day kind of thing. And I was like, this is it, I'm done, I am writing this book. I'm going to write, let's see, what would interest people most to get them informed, because they're clearly not informed. And I was like,
Hmm.
oh, well, I did abortion for 8 years. That's a great topic. It's abortion, it's sex, it's, you know, shame. It's like, ooh,
Oh yeah.
let me be on the wall, a fly on the wall of the abortion clinic. So I was like, all right, I can write about that. And as I started writing, like my instinct was to write like a good college, you know, term paper, right? Because that's what you and I do. We write
Hmm.
like in APA
Instantly go
format.
into nerd mode. Yeah. You're like, okay,
Yeah,
let's, yeah.
nerd mode. Yeah, the first thing I did was a lit search, you know,
Yeah, exactly. Yeah.
because that's what I do. And but then and so I did do that, and the good portion of it is that, and I have like, you know, 5 pages of citations because I you know, as a medical, you know, person with that background, I feel like I owe it to people to give them valid and reliable resources to go to afterward. Or at least know that I did it. Like you got to look up the history of abortion.
Hmm.
When you get to that part, you'll be squirming, because
Yeah.
That whole egg and sperm thing, that's new. It's new. That was never, ever what anybody thought up until recently. Well, for the Catholic Church, like about 100, 125 years ago. And for the Southern Baptist Church, oh, the 80s, abortion
Mm,
was fine. Egg, sperm and egg were not considered a soul. It didn't have a soul or ensoulment until 40 days for males, 40 days gestation for males, 80
mm,
days gestation for females. Why, we don't know, but it came from St. Augustine. Like it's got some really strong historical roots. So I started researching it, and then I was like, oh, okay. Well, I got to make this entertaining as well. So I started to talk about my own stories, because some of these stories are my own. Like I talk about my own miscarriage, and I actually weave that into the stories. And then it was, it was a spontaneous abortion, not an elective abortion. Okay, but
hmm.
they're all still, a miscarriage is an abortion. So
Yeah, and
it's,
it's still listed as one medically, but
right,
it's funny how we take moral sides
right,
to
right.
different sides, but yeah, in the
Yeah.
categories you would just list it. But nobody's judging on in a medical chart. They just like, okay, we just need to see it.
Well, they do split it out too. And, that's the other thing women ask all the time. One of the most common questions I get is, do I have to tell my doctor it was an abortion? Elective abortion? All the time. When I'm sent into the ER, if I have to send them, they're like, do I have to tell them? I'm like, well, you
You
should feel
should, yeah.
comfortable, and you
There
should
you
feel
go, yeah.
safe to do it, and like,
That's more of
listen,
it. Yeah, you should feel
uh,
comfortable because it helps grow the history, but
right.
it shouldn't be a point of
No.
contention.
Mm-mm. But it is, let me tell you, I'm like, I've had so many patients say, my
Yeah.
doctor lectures me all the time about being pro-life. My primary care doctor is very pro-life. And when she found out I did the book, oh my God, we went into it. My blood pressure was so crazy. And I was like, okay, this is not therapeutic for me. I'm here as the
Yeah.
patient. You have to stop. And she's like, all right, but,
She blesses
so,
you out, then checks your blood pressure, and it's like, why is it
oh,
high?
she's like, I was like, you're not increasing my blood pressure med. I will check it at home after this because I'll be fine. So
Uh-huh.
yeah. So it's like, so what did you ask me? You wanted to know, what did you want to know? I think I got off topic.
I wanted to know. Well, okay, so I wanted to know what were you've kind of already gone on to it about what your intentions were when you were writing the book.
Oh, yeah.
And so I actually thought that you did a really good job. I've only read a little bit of it, but like you gave very like factual information, and then when you were painting the pictures of all the people, you were definitely doing it in a very literary way. That's why I was almost curious. Did you have like a what do they call them, like shadow writers or somebody that goes
Oh,
over?
thank you. I'm so honored. No, I did not. I wrote
Oh,
that
because that
myself. I'm kind of
I would have
like,
needed one for that kind of
I
like
think,
painting the
yeah.
picture.
Yeah, no, you're right. Thank you. I feel so honored, because no, I wrote them. I wrote them from my memories, and I wrote because I'm a writer too. Like
Hmm.
later on in life, you have time to discover things in yourself that you didn't really know you had. I thought I was good at term papers, but turns out I'm actually a really good writer. I started doing a lot of journaling as well, like before that, to try to like put things in place. So no. And when I sent them to, my former colleagues at the abortion center, they're like, how did you remember? Oh my God, you remember that person. You remember that person. And I did take the stories, and I condensed them and moved them around a little to change up, because this is all real stuff. Like everything
Hmm.
I'm telling you, I may have like taken two patient stories and like kind of condensed, or three, or they're just so super common. Like I would see the same things. Like I had a reviewer say, "Oh, this was really hard to read because I know somebody who went through. I've known so many people who've gone through these things." So I actually took composites, and I became like a literary person. It was hard to write like a
Hmm.
literary person, but I wanted it to be literary. I wanted it to be fun. And then in the middle of the book, I just went all total fiction. Like it looks like fiction writing. And I will say, technically, it is, because I took composites and I took gems from my own memory. But no, I wrote it Oh, thank you. I'm
Oh, like
so proud of
nonfiction, you
myself.
mean?
Yeah, like I took, I think that's what fiction writers do anyway. Is like you take nuggets of reality that stick with you and then you turn them into,
Oh yeah. So then
cool
you where you more
story.
yeah, I actually no, I really like that. Because for one I could tell it kind of made it fun, but then it
Yeah.
also yeah, those are the times when you're really like remembering that person as they are. And
Mm-hmm.
that I think is one of the key parts to this whole issue is that you have to almost see each person individually. And we're trying to make rules for one side or the other, but this one's it feels very individual
Right.
um in the
Yeah.
topic just in general. So you have
Right.
to look at it case by case.
Right.
So
You'd
you can't
see
really
one
draw your
patient.
line ever.
No, no. And that's why I wrote those fictionalized accounts too, because like you have to see the person in their entirety. Like you have to see that lady go home after abortion or see her what's leading up to it. We don't get to see that. You and I, we don't have time. Like, and it's just so if you can write a book and sort of get that, you know, like the girls down at the shore and one is pregnant and swears she was date raped, like how we don't see that, we don't have time for that, and yet you and I know as human beings, like we're going through life with people we love or friends that we have, like we have to we have to be able to get to that. And I do think that the whole conversation on a larger level, like all of like politics, medicine, that's how we're going to get where we have to go. We're in a quagmire right now. We have our pro-lifers, we have our pro-choicers, we have people fighting, and the only way we're going to get through this is like one person at a time, one heart at a time.
Yeah,
I mean,
I
that's what
agree.
you know, opening your heart just for like, just to see what's happening to that person.
Everybody's looking to convert the other side
Right, right,
in the argument, and nobody's actually trying to listen. Like I
right.
find that um I have the biggest breakthroughs of my life were times where I thought something, but then I just let the other person speak, and then I was like, and sometimes you still draw your line. You're like, you give like a little pushback, but then you walk away, and you're like, I didn't ever think about it like that. I probably should at least like pull out my line in the sand.
So my friend is a pediatrician and he teaches med students, and he was over the other day, and you just made me so happy. I'm going to tell him that you
Okay.
said that, because he
Yeah.
said his biggest challenge in teaching his medical students and residents is just that. It's like, pull up your stake out of the sand. You were trained from a very young age, and your whole life has been spent finding the right answer.
hmm
And there isn't a right answer sometimes. Like, so just open up and like tell the universe, like, tell me something new. Tell me something that I didn't memorize. So
Yeah.
yay. Thank you.
Yeah. And you're born with these your brain is hardwired for biases. And so if you just I found that excuse me. But I found that if you go into like a clinical setting and you're like so set on like, I ask these questions, I get these answers. We're gonna knock this out as quickly as possible.
Yeah.
I found that because usually it's for time,
Yeah.
you get in
Oh,
that
it's
zone
real.
and you're like, let's go, let's go.
Yeah.
But I found that if you go in there and you're like taking everything in, like I've like especially critical situations, if you take a second to pick up everything and like realize the questions that they're answering and trying to get to, you actually move way quicker and you actually get to the bottom of it.
Yay.
Yeah, I mean, it's really
Yay.
like you're like, why is my brain actually telling me the right answer? But it doesn't follow any of the protocol.
I love it.
That
I
yeah,
love it. Oh, I
it's
love it.
really
I'm
just
so
listening.
happy. So
Yeah,
wait, what specialty do you want to go into?
I'm gonna go. I think so. I'm still in the interview process, but I'm
Yeah.
thinking it's going to be emergency medicine.
Oh, good. Well, then
Yeah.
that's the perfect place for that, because like you don't get a diet. They're not coming in with the whole, all their tests done and their diagnoses and everything. It's
Yeah,
so, yeah,
it's just got to be you listening, and that's one of the things that I love about it is you're the first person to collect the history, so you really have to be. You got to take the wide-eyed approach. You can't just narrow in
right,
because
right,
hell, like there's a lot of times where the thing that somebody's talking about isn't really the issue at hand.
right, right. And you got to like kind of Yeah, I know they get off track, but then you're thinking about like, why are they going on about this? Like, what's behind
Exactly.
that?
Oh, that's happened. And I've learned that from just, luckily my mom's an ER doctor. So I actually got to see it in person a lot way earlier where like somebody's saying something and you're like, hey, maybe we should pay attention to that. And then she's like, no, no, no,
Right. Like
there's something else off. And
you weed it, you'll learn to weed out because sometimes it isn't like the thing you're getting to. But I will tell you this too, because I know I don't want to forget to say this. Medical
yeah.
students and no, I'm going to say it like this. So being on call, I'm getting calls from ER physicians and providers because they don't know how to take care of abortion patients. They are calling me on the
Mm-hmm.
hotline. So I just want to be really clear that like about less than about half of all medical schools, they're not teaching how to take care of these people. And 1 in every 4 women will have had an abortion by age 45. So I just
What
am
was that statistic again? Sorry. One in
one in
every.
four
That's what I
women
thought.
will
Okay,
right will
man.
have had an abortion by that's better. 15 years ago it was 1 in every 3 women
Oh my
will have
goodness.
had an abortion by age 45. It is the most common surgical procedure for women in this country. And our ERs are freaking out. They don't know how to take care of these patients. So I'm just saying, learn it, learn what you need to learn. I don't mind physicians or PAs or NPs calling me at 4 a.m. because they don't know what to do when the patient presents because I just sent them there. But I think being able to have the confidence to be able to care for these people is super important, and we're not teaching it. And in some of these states, I was just looking it up before I got on because I wanted to be clear about it. The medical schools are like their hands are tied about teaching the content. Did you get any content on abortion?
I mean, that's what I was trying to think, especially in the schooling part. That's more
A didactic, yeah, classroom.
technical. There might be mentions about abortion, but because it's not directly in the pathway of any kind of thing, I could see why it would be left out of the
Yeah.
like of the education part. But then I will say, like, if you're a medical student going through your rotations and you're thinking about emergency medicine, pay attention to when you are in OBGYN. I remember
Mm-hmm.
that's when something I told them, I was like, hey, I'm thinking about going in emergency medicine. They were like, well, we're going to teach you everything because we keep getting called for this. So you're now
Mm-hmm.
coming for every. Um,
We laugh because the ER. I was just talking with an OB nurse the other day, and like you see like women in labor. I think the early pregnancy stuff, maybe the ERs are doing okay, but and it's been since I was like a new nurse. ERs don't want to deliver babies, man. They will get them through that ER so fast.
yeah.
Like no, we're not doing that. And
I
this
and I could
clinician
see where you're like, hey, I'm probably not the best person to be
right.
doing this. Um,
But the
but
lay public, they're shocked. They're like, "What do you mean, really?" I'm like, "Oh yeah, really. It's a
but you
high
will.
liability. It's high
The
liability too."
Yeah, and that's why you want to get it out. But I can definitely, though, the key is to still understand all of that aspect because that's a very common, whether it's
Yeah.
foreign bodies or birth, like you're going to have to deal with that at least once, twice. My mom's delivered babies in cars and
Yeah. Oh
I
gosh, yeah.
mean everywhere. So you never really, um, you really need to. You'd be surprised how many OB or you know, um, guy problems come in, and especially as a male, you got to really,
Oh yeah.
you better be comfortable at least doing some of that, not being like, have your freak out moment.
Exactly, exactly. Yeah, they're like, call me. And the patients sometimes know. I had somebody in Mississippi like a couple months ago, and she's like, I'm not going there. And I was like, well, I don't know. There's nowhere else for you to go. You need an ultrasound. I don't know what to tell you, but you need an ultrasound and you need it now. And then they called me and they were like, really the staff called and I was like, don't be afraid. Like, what you know. You do know what a uterus looks like. You do know when there's a stripe. You like so like don't freak out. But like the whole thing about abortion and it's
Yeah,
making providers crazy.
yeah. I mean, it's definitely nerve wracking, especially if because I'm sure if you don't see it very often or whatever, and it comes in and it's a little tricky, and you watch something on the news earlier about
Yeah.
it, and now you're like,
Yeah.
um, I did want to ask you one question because I know we may be getting a little I don't know how much time you have, but
I'm fine.
I wanted to know, I was curious because we had talked about it a little bit about how people are drawing their lines and saying like, how do you think we can like depoliticize abortion and come to like, or at least just come to a understanding that's somewhere, I guess it would have to be in the middle, because if you stick to one side or the other, it never's the right way.
Right. So again, I think it comes down to telling stories. Like even in the clinical world, we love stories. Stories are a very powerful way to teach and to open minds. So I think being able to we got to tell the stories. We got to, and that whole idea of walking a mile in somebody's shoes, just both sides, that's the thing. So I taught and I tried to do that, and not just for women but for men. I have a few stories where the man is actually the main character in the abortion story, because there's a lot going on there. And I think if we get too crazy about women's rights, uh, um, and these are men that are also suffering, um, we're not healing, and everybody's just
Yeah.
kind of retreating further and further into their camps. So I do spend some time talking about my favorite protester, pro-life protester, and where his brain is, I think, um, because I think we all have to own it inside ourselves. There's conflict, there's pain, there's shame and secrecy. And so I think that the women's groups are trying to do a really good job of educating people and telling their stories.
Mm-hmm.
Um, and some people, you have to understand and respect that the stories are too painful. They are too painful for them to hear. I often call it like we're in the time of the fetus now, and for people to think about the thought, even my GP, the thought of like not of destroying a potential life, it's so painful for them. They can't hear it right now, they can't. But like, where do we, I think most people are willing to say, well, I can't bear thinking about it, and it's really upsetting to me. But I also have to, I do think I understand a little bit about the women that are undergoing abortion, choosing abortion, and how it's not easy for them either. It's not easy for
Mm-hmm.
any of us. And
Yeah.
that's the bottom line. None of this is easy for any of us. And to say that it is, that's where we're stuck.
Yeah. And when somebody's yelling at you saying that it's easy for you, you're like, and you're having, I would imagine like if I was a female that is, now I'm about to do a bunch of what ifs or whatever, but if I
It's good.
was a female that was pregnant and decided that I was going to get an abortion, like there would be so much mental weight even in just that decision. Like even if I knew it was for the right motives, like sometimes you do things for the
Yeah.
right reasons,
Right.
but you feel terrible about it during the process
Right. Or
and
after.
or after, yeah. And
Mm-hmm.
so it's like going to do that, that's already probably that person's worst day. And the
Yes.
last thing I
It's a
want to
really bad
be
day.
is part of their worst day by being the one that yells at them. Like that's the thing that they also remember on their worst day is
Right.
like
Right.
that was already a bad day. And now
It-
it's the
Now
worst
it's
day
really
ever.
bad. And there's a lot of that. You'll be sorry later. You'll be sorry later. Okay. So the thing with that is 80% of women who are surveyed, and this, we have tons of data on this, their number one feeling afterward is relief. There's also the Turnaway study, which was done out of UCSF, that is phenomenal.
Mm-hmm.
Obviously, they had to be perfect. It had to be a perfect study. They followed women for 5 years, who were, they followed women at an abortion clinic. They went to the clinic and they recruited patients. A percentage of them were turned away for a variety of reasons. The other and had the baby, and the others who had the abortion. They compared the two cohorts, and the data is, I won't go into it here, but it's overwhelmingly clear that the women who were able to terminate knew what they needed for their lives. Their long-term outcomes are way better. Lower rates of depression, lower rates of, I mean, their socioeconomic statuses are way better, and that kind of thing. Not to say the women that carried to term don't love their babies, they love their children.
Mm-hmm.
Make no mistake, because of course you would love
Yeah.
your child, right?
Yeah.
So it's a beautifully done study that actually the pro-life community hasn't really been able to attack, so they just don't talk about it. But the data is really strong, and it's all around your perception. If you the patients that do worse, to be honest with you, are people who come in, they're very devout pro-life people who have an abortion. Clearly you could see why that person is going to struggle later, right? Because
Hmm.
they were super judgmental. Now they went through it, and they go back to church every week and they're told that it's baby killing. So of course you're going to have some psychosocial issues afterward if it's culturally framed that you did a terrible thing. But if it's culturally framed that it wasn't a terrible thing, it was a terrible decision that you had to make, it's going to be very different for you.
Hmm. And I can even understand that study, because sometimes leading up to a decision, we always feel that anxiety or whatever, especially when it's you know, it can go both ways, or it's really it's all deciding on whatever you decide to do.
Yeah.
And so you get really, but once you make the decision, once you go left or you go right or whatever, you're like, hallelujah, thank God,
Yeah,
I
right.
just made a
Either way.
decision. Um,
Exactly. At least I made a
either
decision.
one would have worked, but and
Yeah.
so,
Yeah.
were there any times where there was somebody like a grandmother bringing a daughter in or whatever, and she's wanting some, like, putting pressure on the other person to get an abortion?
Absolutely. And that is one of my other favorite chapters that you're just gonna
Yeah,
have
I
to
got to read this whole
you
book
got to
now.
finish the book because like it's crazy. Yes, yes. And so yeah, I don't even want to go into because I just want you to read it. But yeah, there's some really compelling stories of that. And let me just tell you, like, if the patient, if you're in a state where they're emancipated minors. So I will just say that an emancipated minor, if they want to have that baby and their mom doesn't want them to have the baby, too bad, mom, you're a grandma now, and you will probably be raising this 13-year-old's child.
Yeah.
So, and the rebellious teenager and the whole thing. Yeah. Oh yeah. It's lively. It's a lively place socially.
Yeah. How did you cope with like all that stress? I mean, not only like protesters and everything, but just the people. I mean, you're having to deal with, I'm sure there were tears shed on a regular basis, or there was
Yeah. It's just,
just on people's situations. Like, I find myself leaving like the emergency room and stuff like that, and I'm like, God, my life is not as bad as I thought. Like, you're like,
yeah.
I
Yeah.
want to complain, but I can't.
Yeah.
How did you
So how
cope
do you
with some of that?
cope?
Yeah.
I again, like, it's pretty much, to me it was so similar to all aspects of, being a nurse and taking care of patients, same as being a physician. um what are the things that you do? Like you said, you walk out, you're like, oh man, I'm going back to my normal life after seeing, like, you don't even have a sense of what crazy is anymore.
No, as I say, yeah. Which I don't know if I had any of that to begin with, but no, I was kidding.
Right, like, what is crazy? Am I, like, your sense of reality just gets so changed by all the things that you see. um so it took me a long time, I would say. The day-to-day stuff is that self-care stuff that we do, and I think your generation is better than any of us so far in doing the things that you need to do: meditating, journaling, releasing, those things. Often, of course, talking to your colleagues. Like, you can talk to your family, but like, if they're not a medical person, you want to, your colleagues get you. They get what
Hmm.
you just told them. And you can go home, and I would go home and tell my husband, who like works in, telecommunications, and he doesn't get it. Like, he's sympathetic, but they don't get it.
Exactly. Yeah.
Yeah, I think having, and with this, in this day and age of being able to talk on Zoom and stuff, being able to talk to people, your peers, and talk it through, because you're going to have days where I mean, you feel just trashed. You made a mistake, you missed something, or the whole medical error thing, and again, being able to forgive yourself for the things that you're trying your best, and you did great with 8 patients, and one went like south, the other one died. Like, it does, it's all part of what we do, and you have to hang on to the fact that you took care of 8 patients really well.
Hmm.
um you
And
know
that's always the hardest part, because me, I'm like a self critic. So I'm like, yeah, you took
yeah.
care of 8, but what could you have done? And then it's like, you have to find the happiness in your own, because
Yeah.
if you start to beat yourself up over it, some things can't be helped.
Right. It'll eat you alive. And there is a fair amount of suicide, amongst healthcare professionals for that reason. And listen,
Exactly.
you went through far too much training. You are far too valuable alive. You are. We can't just easily replace you because you're melting down.
The government
So
says that all the time about my student debt.
yeah, you're way
Way
too
more
valuable.
valuable alive.
Yeah, but okay, but then what are they doing to help you do your job? What are they doing to help you support you to be able to cope with the things that you see, the things that you do, and to actually acknowledge, the good that you've done in the world because you're doing so much. So I think being able to look at it that way is really important. For me, I feel like I'm just sort of like a little cog in a very big wheel of life. It's not even just like a hospital cog. Like I'm just this little piece. And where I come into the story, whatever that story happened to be, or if the patient, died and like because the medication I gave was wrong or something, like I start to think of it in a bigger way. It helps me spiritually to think about me being in that moment. Why was I in that moment? What can I take away from that? What's the pain that I'm feeling? And how does that enrich what I do as I move forward with humanity? Because it is my mission. It's why I'm here, and
Mm-hmm.
it's why you're
Yeah.
here. You were born for this. You were born for these times that suck.
Yeah. You're responsible for bringing these crappy times to an end. Nah.
Just being part of it and being present in it,
Exactly.
because yeah, it's like being like Voldemort, not Voldemort, the opposite.
Oh,
It's
yeah, I
like
was gonna say
Lord
that
of the
one might.
Rings, the
Yeah.
Lord of the Rings guy, Gandalf. Like you're like
Oh.
galloping through on your like white horse as the world is like crashing and burning, but you're just there. And just
Mm-hmm.
being there does more than you would ever realize. You just taking that second in that critical situation and just going, that does more than you know. It really does. Don't
Yeah.
ever underestimate that in yourself.
Wow, that's a very enlightened way to actually view it, which is that's exactly what you need to have. You need to have your brain in the right spot so that you can handle everything. Do you have like a ritual or anything to where you get in the right headspace for certain scenarios or like to decompress?
Yeah, like I do love I like to I find meditation and journaling for me. Journaling is super important for me. Because I'll like if I can journal it out and I release a lot of this stuff. And they always tell you about liability, like not journaling, maybe if you are journaling about a specific patient, then just burn it later. And you always have that option to burn whatever it is you wrote. But writing letters to myself also is
Hmm.
pretty helpful. Um, and people say, why do you talk to yourself so much meaner than you would talk to a patient? Why do you do that? Would you talk to a patient that way? No. So why are you talking to yourself that way?
Yeah. I mean I talk very uh I've talked way better to patients than I do to myself. So that is
Exactly.
the man in the mirror is very rude. Uh
It's so true. That's not right. You're doing your best.
hmm No, that so yeah, I usually have to go on like a run or something where then everything else goes away and then it's like, oh, there was your clarity right
Yeah.
there spelled out.
Right. Clear your head. Just empty your head. Yeah.
Yeah.
And meditation is good for that. Running,
Meditation I've
whatever
heard
it
is
is. Yeah, but not everybody can. I'm not the world's best meditator. I do it, but like I have to say, even after like 15 years, I'm like not that great at it. But I do
Mhm.
it, and they say, no effort is wasted, and it's
Yes.
true. And over time, so but the thing that you do, if you run and you run it hard and you run it out, and then you're like, that's good. You need to do
Yeah.
that.
I always go to meditate, but then I only make it like 5 minutes and I'm like, ooh, I've reached enlightenment. Time to get up. And then they're like, there's no way that this kid,
Well, you
yeah.
just let it. You know what? Then that's
Oh, got a
fine.
great
And
idea. You're right.
oh,
Mine
great.
does
Let me go.
wander.
Let me go do. And your mind wanders. And you know what? But even if you did it for like a minute, there's this 1 minute meditation that is amazing. So if you have 1 minute, go in the bathroom when you're at work, when you're doing your residency, I'm telling you, do the 1 minute thing. Like you walk out and you're like,
What is the 1 minute meditation? Is
it's
it
like it's on YouTube. It's on
YouTube?
YouTube.
Okay.
Yeah, it's there. Like 1 minute, I swear to you, you're like, It's that, and I always say that, like with patients, if you're like standing over them and you're rushed, it like 10 seconds, you sit your butt down next to them and you go like this. That was 5 seconds. Okay. That was 5 seconds. And so, like you said, you're going to save time in the long run, because if your whole body is tense and you're like holding your clipboard and
Yeah.
you're like, right. So it's those little things that get you through. And knowing that you were put in that situation for a reason. And if you fucked up, it is what it is, and it was probably part of a larger plan for a patient. I'm going to
Mhm.
just say that I have seen it. It's like, all right, well, they need to go and you're here to help them and you didn't want to, and it's painful for you and you need to work through that, but in the end maybe it was a part of something that you're just there as a presence, and
Yeah.
they're lucky they had you.
That's actually, I hope everybody is listening to that, because that was actually very great. Because you can't do you can only do the best that you can do, and that's all
Exactly.
that is needed in the world.
Yep.
Like everything will change after that. But
Yeah. And if you learn from the things and the pain that you've been through as a provider, you're going to just get better and better and better.
hmm yeah, yeah. Um, Man, that's awesome. So what's next? What comes next? You wrote a book. You're currently doing telehealth.
I don't know. I do not know. I do
Any
a lot
future
of
ones in
things.
the?
I
And
actually sing right now for hospice patients. So I'm part of a group that where we go around and we sing for the dying. So I've been actively involved in that. I may do more work in hospice. I love end of life stuff. I love it.
hmm
Um, so we'll see.
Well, I'm excited to see, and I'm definitely going to have to finish the book. I will say, everybody go check out The View from the Clinic: One Nurse's Journey in Abortion Care. I found it on Audible Plus, but then I didn't have a credit, so I was like, I'll wait. And then I got a credit yesterday, and I was like, I don't have enough
Yeah.
time to make it through this thing. So I'd
No, I
only read the.
narrated it. That's the other thing. I narrated my own book.
Okay, yeah, you've got
Okay.
a great voice for that too, so that's
Thank
perfect.
you. Yes, I knew I could narrate it. And they said with memoirs, it's always better when the person who wrote it narrated it. So it took me 11 hours. So please go get the Audible and listen. You can do it
Yeah,
while you're jogging. You can do it.
yeah, if you can deal, if you've been around for this long, you can definitely deal. I find it better, especially for those moments where, like, or these kind of books and everything, where, and especially because you're painting the picture. Like as I was reading the excerpt, I was like, this would be fantastic if I was listening to it, because you were
Yeah.
just like painting the whole picture. So,
Yeah.
yeah, go check it out. I guess you can definitely find it on Audible. Is it at
Yep.
Barnes and Nobles and all
Yep.
the other
It's
places?
at Barnes and Noble. It's at Amazon. The Audible book. I have a Kindle. I did it all. Like I did it. This is my gift to humanity. I self-published this with my own money because I so believed that I didn't want to wait for a publisher and beg somebody. I
Uh-huh.
knew it was good and I knew it was important. So yes, I used my own money. I figured, my 401k is crap anyway. So this is my gift to the world, and it's a message of comfort, it's a message of hope, and it's tough stuff too. So thank you so
Well, yeah,
much.
of course. Yes. Thank you for coming on. It's been great. Everybody go check out the book, The View from the Clinic: One
Mm-hmm.
Nurse's Journey in Abortion Care. Yes, Patrice, it's been excellent. You've actually given a lot of enlightening things. So I hope anybody still listening I'm sure they enjoyed it thoroughly. So I want to
Oh,
thank you.
oh, I'm so glad, and best of luck to you and to anybody else who's listening. You guys
Yeah.
are our future, and I'm just so excited about it. You're awesome people, and you're going to do good things.
Awesome. Thank you so much, Patrice. And then thank you everybody for listening. All right.
Bye.